What's up, Simple Church? First off, thanks for even watching this video because I am going to do my very best to answer the questions you guys have submitted. And the good news, I'm not going to do it by myself. We have brought in the experts from our local area, some very knowledgeable and trusted doctors from our local community that have been dedicating their life, not to just the last few years, but over 30 years of experience to try to help you with some of the questions you've been asking us. So Dr. Vanchiere is going to be here, Dr. Martha Whyte's going to be here, and Dr. Keith Scott are also going to be at this table discussion to try to continue the COVID conversation and specifically address questions when it comes to the vaccination. And trust me, you guys have done a great job of sending in questions, and I did my very best to bring each and every one of those questions up to try our very best to inform you and educate you on what's going on and how you can be a part of the solution. So, without further ado, enjoy this. If you have more questions, make sure you email us at justin@thesimplechurch.tv. I'd love to try to continue the discussion and try to help solve problems. That's our goal. Love God, love people, and solve problems. So without further ado, here is the conversation. Enjoy. Thank you for being here. You guys have done an amazing job in the community, but we are starting the conversation about COVID, or continuing, I should say, and really trying to answer specific questions. So you already know, if you're watching online, who these wonderful people are. Thank you for what you've done for this community, for our state, and thank you for being willing to answer these questions. So let's get right into some of the ones that people have submitted. For example, let's talk about the numbers. We were talking right before we went online that there are skyrocketing numbers in Louisiana. And I think you have a graph, Dr. V, that we want to show. Dr. Vanchiere brought a graph. So let's talk about these numbers and why this is so important and what has changed from the beginning of the pandemic until today.
Right. So this is a graphic from the Department of Health that they put out yesterday, and it shows from the beginning of the pandemic on the far left over to the far right, the current day, and the number of cases per week that have been diagnosed. Cases, I believe this is per cases.
Yeah.
So, and you can see the early surge, peak, surge 1, 2, 3, and now we're in surge number 4 of this pandemic. And what's most important here is that the color of each line is a different age group. And you can see across the top those age groups in orange and in gray. And the far right here, what you can see is that the most rapidly increasing, in most cases we're seeing right now, is in young adults less than age 39. And that's what's driving this surge right now.
So when I heard coming in through multiple news sources that Louisiana is leading, this is what we're leading in the age group, which is different than before.
Yes.
And what is the challenge with this for you guys now? Is it Delta variant? Is it a lack of vaccination? Is it a combination? Give me some of the feedback of why you believe it's skyrocketing and what are we going to do about it?
Well, you have young, very social people
Okay.
who are not vaccinated, either because, our younger children cannot be vaccinated, but the above, 12 and above have chosen not to get vaccinated. And they're very social. They want to be out, they want to be with their friends, and they also think they're invincible and this isn't going to touch them. So you've got a whole group of people who are now at risk, and we've got a variant that is more contagious, more infectious, and it's spreading more quickly, and it's making people sicker. And so we're in kind of this perfect storm to see these kind of numbers.
The other thing that I think is very interesting, if you look at the age group variation in vaccinations, people above 65 in Louisiana, we're almost at 90%.
Okay.
That's amazing. Below that, we're dropping to 40, 30. When you get to that 29, we're at 33%. The math is not difficult. The reason old people aren't there, if you look at our institution, what we have the most critical, the oldest one we have is 41.
So this is at currently LSU Oshner,
Yes.
your COVID patient.
Our worst, sickest patients are below the age of 41.
And so what that looks like is a year ago, the average age in the hospital was 65, 70. Now the average age of people who are hospitalized with COVID is 25 years younger, in the 40s, in the 30s.
Yeah.
We're seeing young pregnant women extremely sick, having to go on lung bypass to survive. They're fighting for their life.
In their 30s, in their
That's right.
20s.
Right.
Exactly.
And we actually had a newborn born with COVID that went straight on the ventilator. Luckily survived. There's been fetal demise in other areas of the state. So it's not a nothing virus. People want to believe that they're going to be the one that gets sick and do fine. But the truth is, you don't know that.
So this is why I'm kind of, and my mind is blown, because as I'm coming in and I'm thinking, all right, we're sitting down and we're going to try to answer all of the skeptics' questions. And the reason I want to start with the numbers is, okay, skeptic, the data doesn't lie. This is one of the things that people come back at and say,
Yeah.
well, where'd you get your data from? I'm like, from the hospital that you're actually working at,
Right.
correct?
Right.
Right. And let me tell you, every one of these cases has a positive lab test that's confirmed, that's visualized. These are positive cases.
Right.
Every one of the deaths are verified COVID deaths. That's another one you hear all
Oh,
the
yeah.
time. All those people didn't die from COVID. He had cancer and just happened to have COVID. Now, I actually have to review every one of those deaths in 9 parishes. So there's someone doing that in every parish. Those deaths are verified that they are a true COVID death.
Wow.
And the other thing, again, getting back to the math, if you look, and I mentioned this earlier, if you look at states that have very high vaccination rates, and let's take Vermont, they're at 82%. New Hampshire is about 80. Maine is almost at
Right
80.
there.
Yeah.
If you look at Caddo Parish, not the state, Caddo Parish, we have twice as many cases in this parish than Vermont, New Hampshire, and Maine combined.
That's right.
And our
Because we're at 33% vaccinated.
30.7.
Yep.
Yeah. So
30.7 to be specific.
30.7.
30.7. So, the math, like I said, this isn't calculus. This is simple math. And if you think, like I said, vaccine, I'm afraid of this, afraid of that. Well, vaccine hesitancy also says that I'm afraid for me, but also says I don't care about you.
Yeah,
And that's what upsets, I think, all of us as healthcare workers is when you say, I'm scared of the vaccine, you're also saying, and I don't care if I infect you because I'm afraid.
Yeah, and I think that's probably the reason, like when we were approached and asked, would you do a vaccination event? Would you just be willing to host it? And I'm like, of course we would. It's in our byline. We want to try to solve problems, not be a part of creating them. Where I was surprised is that even in the Christian culture, that we don't see that it's not about just me, it's about you, it's about my neighbor, it's about my community. And when you see the community being affected, that's what's alarming to me. And I'm like saying, what can we do? That's why I appreciate you coming in to try to answer whoever the questions are, going, this is not a political issue. Although everybody tries to make this
Right.
political, I'm like, no, this is a life or death health crisis
Right.
Right.
that we are all trying to figure out the best way to get out of it.
Yeah.
So as we're doing that, you have seen the research, and the data supports vaccines, when administered, and given the time, does it take 5 weeks for that to get into
2
your
weeks.
system?
2 weeks after you complete the series. So first dose for Pfizer, you wait 3 weeks for your second dose, and then 2 weeks later, you're at full protection.
Okay.
Moderna, first dose, 4
4
weeks later. 2 weeks later, you're at full
So a
protection.
total amount of time between first and last vaccination is how long before full?
5 to 6 weeks,
5 to 6
depending on the
6 weeks.
dose.
So
the
this
type
is
you
why
get.
I tell people that are watching this now, we're going to have an event in August 22nd. Go now. Don't wait on hosting it. I mean, just
Right.
because we're doing it
Right.
here, the sooner you get vaccinated,
The better.
the better.
Right. Because right now, the reality is we can't vaccinate our way out of that surge, the current surge we're
Right.
in, right?
We-
Because
we-
of that
we-
time lag.
We've lost it.
This surge is upon us. We may change the tail end of the surge, right? How long that surge lasts, but this surge is not going to abate in 2 weeks because we all get vaccinated today. We're not going to. The only thing that will change this surge is wearing masks.
Right.
Again, not a political statement, a reality, a fact that masks work.
Okay, so
If from a Christian point of view,
Yeah.
I wear a mask not to protect me, but protect you from me.
Yeah, tell them the story, Keith, because it's pretty interesting. You went to the grocery store. Give them the grocery store story,
Well,
which is pretty
I went to
awesome.
the grocery store and I was social distancing and had a mask on. The guy in front of me didn't. And he looked back at me and said, "You ain't going to catch nothing from me." And I said, "Sir, I work in the COVID ICU. I'm wearing this to protect me from you." I've never seen anyone run out of a grocery store faster. I think he left half his groceries. But that's what people don't understand. You're wearing a mask, not for you,
Right.
but for your fellow man.
All right, so let's
And
go.
that's what we have to realize is that you do this as a Christian to protect others,
So
not
the
yourself.
The science of that. I asked Keith when he came in, I said, it's be hard to have a conversation mashed up at the table. He's like, I have been vaccinated. Y'all have been vaccinated.
right
We're
distance.
apart.
We're enough far apart that we can have the conversation, because that's where some of the skeptics go, well, how can we eat? How come, is the dinner table magical that you don't get COVID at the dinner table? I'm like, well, no, it's just a matter of a limited amount of time, and I'm assuming that you can't eat with a mask on. You have to be able to do it. So give us a little science on that and the mask.
Well, and if you're sitting on top of each other at a dinner table with like 8 people around a table like this, yes, you're at risk. So if you're spread out like this, that's a whole different situation. So you do have to be cautious about how you choose to go about doing some of these activities. Doesn't mean you can't do them. You just have to be smart about it.
You're not going to have dinner in a submarine.
Right.
You know, right?
You need a little-
You need to be
you
on the
need some
porch.
elbow
You need to
room.
be on the porch. You need a
Right.
fan. You know, all
Right.
the things. And the
got
way
the
my
air blowing
wife,
pretty good right
well,
now,
the way
so
my
you-
wife and I look at a restaurant if we go to it is how tall is the ceiling?
Right.
And that sounds stupid, but you know
Airflow.
what? It's airflow. It's airflow, and the science is very clear that airflow saves. So I will not go to a restaurant that has low ceilings, and that sounds silly,
Right.
But
but I
you're
know the
also not
science.
going to go with 12 people sitting at one table.
And I'm not going to go with 12 people. It's going to be 2 of
It's gonna
us.
be a
They're
couple.
both vaccinated,
Yeah. And if you go to a restaurant and the serving and wait staff are not wearing masks,
You should leave.
you should think twice and probably leave.
and I walk out.
Yeah,
I
this,
walk
this
out.
is what's interesting to me, and we'll go that route for one second, because I think that's a great point, is we don't have a problem with arriving at a restaurant and knowing our servers having a mask. We're like, okay, that's fine. But we have a problem
Wearing
as
a
a
mask.
culture when we're going, no, I'm not going to put it on. I'm like, but you're good with the server, because you go, well, that's kind of
Yeah.
the expectation if they're in that industry. Where I'm kind of coming back going, well, if you're in a space that we know we're in a surge, and the only thing we have is that because the majority haven't gotten vaccinated, and we don't have enough time for the vaccination to take place fully for everyone to get. That's all we have.
That's exactly right.
Well, and
Correct.
if you're a good Christian person who is truly trying to share that Christian love towards other people, which is our goal, right?
That is the goal.
When you go to a restaurant, if your server comes to you to deliver something or fill your Coke, you should put your mask on real quick. I always, if they come to ask me for my order, or if they come to bring me I stick my mask on. I may just be holding it
My
real
mask
quickly.
is on my ear.
Right, so that
See, when I
because
didn't know that, I don't do. That's a great advice.
The-
I've never. Yeah, that's
the
good.
outbreaks that because as public health, we work the outbreaks. We're the ones that see all the cases, and we have to do all the contact tracing. The people who are getting sick in restaurants are the wait staff.
Yeah.
Because
Wow.
they're exposed to a lot of people.
They're exposed.
More exposure.
The other
Who are-
thing is,
who are
has a
not.
mask
Makes sense.
ever hurt anybody? Has anyone been
a
strangled
piece
by
of
a
cloth.
mask? Have they been
No. And that's why-
intoxicated by a mask or somehow suffocated? It's so simple. It doesn't hurt. So you look goofy. You look goofy anyway.
Well, but I keep
So,
going back
you
to
know,
is the truth
just-
is in the long run too. If that's what I was bringing up with someone this morning, they were going, I can't believe we're back here. Why do we have to go to the mask? And why'd the governor do this to us? And I said, no, we did it to ourselves. So
Yeah.
first
Yeah,
off, let's
that's
don't
right.
blame someone else,
Right.
because none of us. I was in the store yesterday, 2 large chain stores. No one had masks on,
Right.
and it's mandated. So you have the freedom. Go ahead. You go ahead and do that, and we will continue to see it skyrocket, and it will lead to a place that none of us will have freedom.
Well,
Not based on a political
Right.
thing, based on a I'm in trouble, our hospitals are full. So let's go back to the full hospital,
Yeah.
because this is what's shocking to me, that people don't put 2 and 2 together. You don't think you're going to get it, or you're not worried about getting it, and you don't think you're going to go to the hospital. But currently, the hospitals are full. The most hospitalization since the beginning of the pandemic, as of today, that's what's happening in Louisiana,
Yes.
Yes.
which affects heart attacks, strokes, pregnancies. It affects anybody who has a
Simple
crisis.
things.
Yeah, so any
Right.
surgery, because you're full.
Right.
So it may not affect you that COVID has gotten you, but if you have any other incident in your life,
Right.
an accident on the LSU Trauma Center here in
Right.
town, all of that is affected because the beds are then full. And because I saw Lady of the Lake in Baton Rouge just saying, the federal government had to send in staff for
nurses.
doctors and
Yep,
nurses
yep,
because they're exhausted.
Yep.
There's not enough people to handle the crisis.
And
And
the
I'm
other-
going,
the-
there's your sign.
Yeah,
I
well,
mean,
the other problem is what we're seeing is COVID fatigue among healthcare workers.
Sure.
It is, we're
They're
seeing
exhausted.
them mass exodus.
Right.
We're having to pay nurses extraordinary salary to come in because they're tired of sitting by someone's bedside,
And watching
and the
them
last
die.
thing
Oh, yeah,
they
sure.
do is hold an iPad to their face so the family can see them for the last time, and they've done that 10 times a day.
and then leave at home and hear their neighbor say it's not real. And it
Yeah,
doesn't
and
matter,
then
it doesn't affect me.
yeah, and then go to a restaurant and someone say, you know,
It's nothing.
you're just making this up.
Right.
Well, you know, until you zip,
Yeah, it's
you
tough.
know, over someone's face, you know,
Yeah.
plastic bag, and that's someone's grandma, you don't have the right.
That didn't get to see their loved ones before
You
they
don't
died.
have the right.
You know, when Bill was in the hospital, I got to see him because I had to sign. Look, I signed his life away to let him be part of those experimental protocols.
Sure.
Because he was early on in the pandemic and they didn't know how to treat him. And so when Keith and Steve Conrad and them came to me and said, we want to try this, I'm like, absolutely. So I said, he said, well, I need you to come sign this paperwork. I said, can I see Bill? Because nobody
Sure.
was getting, I hadn't seen him. And
Yeah.
he was so sick. And I'm a doctor. I know what that meant. And, you know, his worst, he went through a lot. And the one thing he'll tell you was the worst thing was when he was awake, ventilated, and they turned him around so he could see out the hallway. And every day and night, he saw bodies roll past because they all had to come past his room.
Yeah,
and so
tough.
here he is trying to survive, seeing these people die. Like multiple, because this was early on in the
Right.
pandemic, and multiple times a day, he still has dreams about that. He has, you know, that was traumatic because he's like, why is that going to be me? And why not? Why
Yeah,
isn't
why-
it me?
yeah.
And
Yeah.
why am I blessed? And you know, you have to evaluate so much in your life when you go through that, but he's still dealing with some of that. So to say, and people will still say to me, because I'm out front in front of all this, why, you're a fear monger. You're just trying to scare people. And I'm like, I know more than anyone. My mother died alone in a hospital on the day my husband came home from the hospital. I have been through this with this pandemic. I know as well as anyone. I'm so thankful that my husband survived, and a lot of people's loved ones didn't. I have friends who have lost multiple people in their family. So, you know, to say to someone, to say to me, this is a nothing virus,
It's very offensive.
yes.
And the other
And
thing, they say, you know, okay, I have a 2% chance of getting it. But if you're that 2%, it's 100% to you. It's 100% to your family. It's 100% to everyone involved. And for, you know, the people, you know, that somehow say, you know, I don't want to get the vaccine because of whatever, you know, risk it may be. And I don't want that risk. Also says that I think I have the right to refuse that. Okay, maybe you do. I don't think you do, but okay, say you do. Then you're also saying I have the right to infect you. I have actually the right to kill you because I can give you. 4.6 million people have died worldwide. Someone infected them.
Right.
Yeah, you don't know.
It's-
It may not
right.
be what.
Someone
it may,
infected them.
And we,
So if we
go-
look at some of the data that's very compelling is every year about 200 children in the United States die of flu. It's unusual, but for those 200 people, right, their families, critical. So far in this pandemic, 500 children have died of COVID-19. It's unusual, it's rare, it's 1 out of 100,000 to 1 in a million children who will die. But for those families, it's 100%. And what we know about how traumatic for families the death of a child is incredible. I mean, it is most marriages don't survive the death of a child. It is that traumatic. And so, again, you can play the odds and say I'm not likely. It's very unlikely. I understand that it is, but for those families, it's 100%.
So let's put that up here because this is one of the things that someone sent us, and this is a graph that they were trying to figure out the percentages, and they did a great job of world population, parish population, into infection rate, because they're scientific and they were not being ugly. They were just going, hey, I'm trying to figure out whether I should do this or not. And they came up with the summary. If I've never had COVID, I have an 88% chance that I'll never get it, that I won't get it.
Yeah.
And then if I've never had COVID, I have a 99.8% chance that I will not die from it. But I think what's left out of the data, correct me if I'm wrong, you don't know who you're infecting.
Right.
That's one part,
That's
correct?
one part. Well, the other thing is that all it really says is that it's 88% chance that you haven't gotten it already, right? I mean, this is history. What we know just in the past 2 weeks.
Oh, that's a good point.
1% of people in Louisiana have gotten COVID diagnosed in the past 2 weeks.
So the entire population, 1% in the last 2 weeks.
In the last 2 weeks, right?
That'll skew the numbers here.
That's right, and that changes everything. That's what this surge looks like.
That's what I was going to say. Just like we talked about earlier, this is a different pandemic than what we started with.
Right.
And this is a different strain, and we are seeing different numbers of cases. So all these are going to change.
Right.
But it's still, we have to come back to the vaccine, because that's our only way out
Well,
of
this
this.
is why they're trying to decide.
Yeah.
Because it comes back.
But you can't decide a vaccine or that, because you know what? If I cut my wrist and I go into the ER and they sew me up, I have a 99% chance I won't get tetanus. But who refuses a tetanus shot?
Right.
And that's a vaccine.
All right, so let's get into that.
So-
But some
Right?
people believe
That's a vaccine.
right.
But I think the obvious question then is they're going, yeah, but tetanus has been around forever. The FDA hadn't even approved it. We're just guinea pigs to the government. I mean, has anybody heard that?
Well, I have, and I'll address.
So let's
yeah.
go through the,
Well, let me
guinea
address
pigs to the government.
let me address the mRNA. The mRNA technology has been around about 20 years.
Okay.
They've been making anti-cancer drugs through mRNA technology for a long time. It is a console. It's like a PlayStation.
Okay.
So all they did when this came out is said, okay, let me make mRNA against COVID. So what they did is ejected one game and put in another. So they went from Game of Thrones and put in Call of Duty.
Right.
They didn't change the technology. They just changed what they're putting into the system.
And what they put in was the virus.
Right. The virus, the protein, the spike
Piece of-
protein.
The recipe for the spike
And
protein.
all they did, and they put it in on a Friday night and had it by Monday morning, and they could make it. What people don't realize, they say, okay, this is new, no one knows it. Do you realize we have to make a new flu vaccine every year? People don't realize that.
Right.
We have to predict ahead of time what strains are going to be coming to the United States. We don't test that vaccine. We just make it. And you get it.
And that's
and you
why
get it in
some people-
September.
Because we know the technology is safe.
Right.
And the
Because
other
over time,
That's right.
it has proven to be.
And
proven.
mRNA has done the same thing. We've been using it for 20 years. We just use it for a
And-
different cause.
And where they get the data from, as far as y'all personally in the area, and you are leaders in this area, you're leading our community, it's through time-tested, proven, factual data over a long period of time. Is that correct or not correct? How do you
that's
get
true.
to the point of going, I can trust? So a skeptic's going, man, I'm on the fence, but
Right.
how do I know I really can trust that data?
So he did he's
Right.
part of the research.
We're part of our team is part of the research at
Right.
LSU and with the Pfizer vaccine product. And so last September, we started using that vaccine in a randomized controlled clinical trial. People volunteered to be in it. Some got placebo, some got vaccine. We're all blinded to which one they got, and we watch over time to see what their immune response is and how quickly or not they got COVID. And what was very clear from the beginning was that the mRNA technology gave us a gangbuster vaccine, one of the most effective, safe vaccines we've had ever. What's fascinating is the way we make the flu vaccine each year, that's a biologic process. We grow a virus, takes time, we purify a virus, and then we actually grow it in eggs in the United States, right? And then we develop that vaccine from it. The mRNA technology basically changes that from a biologic process to a chemistry process, a chemistry process that is extremely clean, extremely well regulated, and we know exactly every little piece of everything that's in that vaccine. And there's no chips, and there's no medicine. I
Okay,
mean, metal in that.
Yeah.
Well,
so
I-
now, hold on, let me go into this real fast, Keith. All right, so let's go into that though. So let's go into pregnancy. Let's go into a 12-year-old who is going. It's going to affect their fertility. It's going to. The reason you can 100% say it's safe is because of looking at the data and the way it's created. Correct? Give me some information on
How it works.
a skeptic.
Yeah, how it works. So basically, that message, we're delivering a messenger RNA. It's a recipe to make the spike protein. And that recipe only goes into the cytoplasm part, not in the nucleus where your DNA is.
So it doesn't affect DNA.
Doesn't
It
affect your
can't.
DNA.
It can't.
It can't. It doesn't even get into that part of the cell. Think of it this way: it's like if you had crack an egg open, you have an egg white and an egg yolk. The egg yolk is where your DNA is. This part stays in the egg white kind of
Right.
area of your
Very good
cell, and so
scenario.
it doesn't
Or
get into there
example.
where your DNA is. It can't interact with it. It only does its job baking that cake, making that protein for about 20 hours, and then it shuts off, and then it's gone.
It's
And-
not even in your system because that's the
right.
other thing is they say, well, you're infecting me with this.
No.
You're not in
No.
being infected at all.
No.
No.
No, that's right.
It's not like the flu where they're giving you.
A weakened virus.
weakened
or,
virus,
or
they're
even
not.
a killed virus, right? Those are classic technologies to make vaccines.
Which we take all the time, by the way.
Sure.
To get our children into
Yeah, I'm
school
going back
Right.
and I'm. I mean, I understand there's a whole nother vaccine pro or against side of culture, and I understand that. I'm just trying to get to
Sure.
this specific one
Right.
because I'm going. We've taken vaccines. We will travel around the world. If we go around the world, they require it. So we do it because we want to continue the ministry or whatever. I'm just trying to make sure that that person who's skeptic can have from doctors, not Justin, not a pastor, not your neighbor who is a mechanic, from the doctors
Or
that
TikTok.
understand or TikTok
All right,
how
mostly
it is
TikTok.
how it is created. Because to me, this is why the conversation is important.
That's right.
Is they don't understand and they have bought into something that's not
Right.
true.
That's right.
Because not because they're bad people, maybe because they don't
They're just
fully
confused.
understand.
Right.
And
Well,
that's
and-
why today's so important,
Yeah.
which I appreciate all those illustrations.
And I remind folks, I don't know how my smartphone works. I really miss my flip phone some days, especially now, right?
Right.
But I'm not going back. And this is one where this RNA technology is novel to most people. As Dr. Scott said, we've been using it for 2 decades, and it is an amazing technology. What we predict will happen is that over the next 2 decades, we're going to see more and more better vaccines than we've ever had.
Because now you know that
using
this
this
works.
technology.
Right.
Well,
Exactly.
you remember MMR, which every kid gets, is what, 76%?
Yeah,
70s
better than 80% protective.
Yeah.
Yeah.
Very good vaccine.
But this is 92,
Five.
95.
Yeah.
So it's 10 times better than mRNA. MMR, I'm sorry. Too many RNAs.
Yeah.
But, this is such a good technology
Okay, so-
because the science has
Very
caught up
clean.
with, we can do this fast. And I think the only vaccine that's been studied probably more than this is polio.
And this-
I think that's probably the only vaccine that's
So
probably
let's
been
go into
studied
that
more.
because this is why I'm trying to get to these questions that I have on here. So when someone goes into, and I had another doctor friend, that my personal doctor, when I was trying to determine, because y'all called and said, hey, it's available to clergy. We were in January. This is a long time ago. So I called my personal doctor. I said, what do I need to do? I have the chance. I'm for it. He was like, I have researched this, Justin. I was the first, told you to hold off because I wanted to read the data. I was not going to tell you to go get it when I had not researched it. I have researched it. It is not just go, run, if they're willing to get it to you, because he couldn't give it to me. I wasn't eligible.
Right.
That's right.
But through Christus Shumpert, the Christus group, they were able to let a couple of clergy get it from each church to keep, because we were going in the COVID unit.
That's
I was
right.
helping
That's right.
people as they
That's
were
right.
dying. It was
Right.
complicated. So some people go, why are you so passionate about it? Because I've seen it.
Right.
I'm walking into the room when you call me to go, my grandmother's dying. Can you please go pray over her?
Right.
And some they weren't allowing, but towards the end, if I PPP'd and had my virus, my shots, they let me in, which I was very grateful for. But some people still say, okay, it's been there, but why has the FDA waited? Give them, I kind of think I have some ideas based on my research from doctor friends, but why is there a delay in the FDA approval if for 2 decades, mRNA or whatever has been, been tested, and now we're in this COVID, there's been more research than any other vaccine, what is the delay?
Yeah. So, there are basically two processes. The one we know, and we've talked about this, emergency use authorization. And that is an available process for approval of a drug or a vaccine or technology to use in a situation where, number one, you don't have any other options, like in a pandemic, like the Ebola pandemic or epidemic that happened in the past, and et cetera. So we want to be able to move things very quickly through primarily a safety review. That is it safe, even when we maybe have some uncertainty about its effectiveness, right? It's not going to hurt you, and it might help you, right?
Right.
And when you're desperate, you're willing to accept that risk, right? So the emergency use authorization is that first pathway, and that's where we are. The full licensure, we call it, is that approval that people are looking for from the FDA. That requires a certain duration of time to see exactly how long does the effectiveness last. We're just getting to that point to have the standard data.
Sure.
We don't want to change the rules, right, to
'Cause everybody's
approve it
criticizing that.
early because people are saying, well, why not, right? The rules have not changed to accommodate this vaccine or this pandemic because we want that scientific rigor to be there. If I was changing the rules to accommodate, then you wouldn't have confidence in what I'm doing, right? And the same is true with the FDA. So those requirements for full approval are still the same as they were before this pandemic, and they need to stay that way.
Sure.
That gives us confidence in what the FDA does. And what you've seen is a few times the FDA has paused with the Johnson & Johnson vaccine when there were a few blood clots, right? We wanted to make sure, is this a major problem or is this a rare problem? And if so, how do we deal with it? What are the risk groups and the like, right? And the same is true with the heart inflammation we've seen after some cases of using the mRNA vaccine.
Right.
But what we now know is that case in particular, heart inflammation, 1 out of 10,000 after the vaccine, 1 out of 100 with COVID. 1 out of 100 with COVID, 1 out of 10,000 with vaccine. Now you have the numbers, you know what can happen and how likely it is, right?
And just as any medicine that you take, so let's just go through anything.
Yeah.
They come out with, these are the side effects, or the rest too, because the FDA, based on that data, came up with, I got heartburn. I take whatever, pantoprazole or whatever it is, and they're like going, hey, you cannot take it and have heartburn and possibly have esophageal cancer.
You may have this.
But you might have, whatever it is, another side effect. But I go, hey, it's worth it because I know that the data has proven to be. Where I think people are confused is they want it rushed in one regard. Well, we need the FDA, but then they would criticize it if it was because they'd say, why did you rush it? Because what I understood was exactly what you're saying. It's just a matter of time, and we can't rush time. But as soon as possibly September or October is what I've heard, there's a chance you could be FDA approved.
That's right. And so I think the other thing people have to realize, very simply, there is no perfect vaccine.
Sure.
No.
There is no perfect medicine, and risk will never again be zero. And once you understand that risk will never be zero, then you can say, okay, how am I going to mitigate? How am I going to reduce my own risk?
Right.
Vaccine is the best. Masks are right behind it, very effective. Distance, hygiene, other things. Go to restaurants, not going to restaurants. Grocery store, time of exposure. All of these things are the factors that play into what is your individual risk. And you can figure out for yourself how comfortable you are with that.
And this is what I was going to go back to. So let's go back to pregnancy to kind of go along with those routes. I think that's the thing is they're going, okay, we say, and we're agreeing at this table, that the vaccination is the best way to reduce transmission and eliminate the virus. Masks are secondary because it will obviously be help. But if you had your choice, you would go, we'd love you to be vaccinated and wear a mask. But in the long run, if the vaccinations work, masks would be eliminated, theoretically.
Eventually, yes.
Eventually.
Absolutely.
But in that process, people are going, well, I want to get pregnant. Or I'm worried about the fertility of my daughter. And you're telling us through the research that that's not a risk or a side effect that has been high enough or existent to keep you from getting it, correct?
There is no evidence at all.
Zero
evidence. And everybody's looking for it. We want to have evidence. If it's there, we want to know. There's no evidence available that shows any effect on fertility of these vaccines at all.
And in fact, our local fertility specialists and our local OBGYNs have come out and all over their social media to their patients, they're saying, take the shot. They're encouraging their patients to get vaccinated because we are seeing young, healthy women pregnant on the ventilator. We have one cannulated for ECMO, which is where they bypass their lungs and oxygenate for them. Pregnant in their 20s, now with a very seriously life-threatening disease.
Right.
And it's life-threatening to their child as well. We, like I said earlier, we had an infant, a newborn, born with COVID. We haven't seen that here much in the past, so we don't want to start seeing that now.
Sure.
So the more we vaccinate, and their doctors are coming out and saying, please take the shot.
I don't know an OB in this area that is not saying, go get vaccinated, go get vaccinated. My daughter was, I think she was 20 weeks pregnant, and I kind of forced her to get vaccinated. And just the other day, someone exactly like her, 2 other kids, 3rd pregnancy, passed away from COVID.
And that's the
And
thing, Keith. We don't know who it is.
That's preventable.
It is
so
preventable.
It was
It's
so
100%
preventable. It was so preventable. And I don't know. You know, people are worried about the vaccine and all this. Okay, so there's a risk. Like we talked earlier, heroes are not people that save themselves from a fire. If you're looking at a burning building and people are screaming, the heroes are the ones that run in and try to help save people. You taking the vaccine, you're helping your fellow man, not only yourself, your family, your neighbor, someone at a grocery store, but you're a hero. I think anyone that takes a vaccine is a hero. Sure, there's a risk. Sure, there's doubt. But you know what? We don't do anything without that.
Sure.
And we're not going to gain anything unless we take that risk and have some faith that, you know, people are not doing this for any gain other
and I
than
think
to
that's where
keep you healthy.
There is a trust level that. That's
Yeah.
why I wanted to have. I mean, I've known Keith the longest. I mean, obviously, for the record, how long you been doing this, Dr. V?
20 years.
Okay. How long you been doing this, Mark?
20 years.
20 years.
30, jeez.
So this is what I tell everybody. This is my.
Now, I've been a doctor for 30 years.
Yeah.
I've been doing public health for 20, so we're good.
Yeah, you're in the. So here's why I tell them is like, when a mechanic or a friend who is not in that industry tries to tell me what they know, I said it is comical, because if I have friends in all kinds of industry, it would be like me telling you how to do your industry. Where that's why I'm just thank you for being patient with our ignorance. Thank you for being patient with the people that are not understanding it. But it really matters, because your investment of your life matters to sit at this table and help us. So yeah, Martha, go ahead.
You know, one thing I've said many times is, you know, history is going to look back at this pandemic, and we are the first generation that has not put our community first,
Yes.
that has put ourselves first.
Yeah.
And I tell people all the time, at some point your grandchildren, or if you're older, your great-grandchildren, are going to look back at these history books, and what pictures are you going to be in? Are you going to be in the pictures wearing your mask, getting your shot, doing these conversations? Are you going to be in the pictures with 20 people, you know, having fun? Or are you going to be, is your grave going to be in the picture? Like, how is history going to remember your behavior?
Right.
Yeah.
And are your children, grandchildren, great-grandchildren going to be proud of who you were during this pandemic? We have to start thinking not about ourselves, and not even about the people that we love, because of course we try to think about that all the time, but more about our community. And you know, when we talk about this strain, it's a scary strain to us because it's so contagious, but there could be worse coming.
Oh yeah.
This virus is trying to get better at what it does. It's making little changes all the time. And every person who gets infected is a chance for that virus to grow in you and make little changes. Most of the time they don't do anything. But what if it changes and starts killing 20% of the people who get it? We should be thanking the Lord that this kills so few people, even though it's
Too many.
600,000 people in the U.S.
Yes,
alone.
617.
Because people give me that percentage, that 0.1, you know, and I'm like, Okay, it's 610,000 people have died. What is significant? Is it 1 million, 2 million? The size of Philadelphia is 6 million. When is it going to be statistically significant to you? And
That's a good point.
And those 500 children who've died of COVID.
Right.
Well, and it
Right.
seems to be, this is where I go back to exactly what Martha's saying, is the Delta variant was not the original variant. We already know this. I mean, if you're
We're-
even
that's right.
pretty much out of touch, you realize
We're
that it
halfway
has
through
mutated.
the Greek
Yeah.
alphabet.
Right. And
Right.
so as it begins to continue to change,
Right.
correct me if I'm wrong,
Yeah.
a vaccination is the best way to,
Right.
there's mask in addition,
Yep.
but is the best way to slow that down or stop it.
Yeah.
And we have data to back that up.
Right.
Yep, that's right. And we started talking about this surge in January.
And nobody
we
listened.
said, if
It's
we
gonna
don't
happen.
vaccinate
I
January,
know.
February, March, April, what will come is a surge.
Right.
And it's going to be among the unvaccinated. We
You
said
know,
that.
and we
and
didn't.
it's going
at
to be
that
a
ti-
variant.
And that time we didn't believe or didn't know. Correct me if I'm wrong. That it would be as young as it is.
That's right. We didn't
Right.
know what it would
Because
look
we
like.
didn't know. You don't.
Right.
This is where I get frustrated. People are like, "Well, they changed. They changed." It's not like this has a roadmap.
It's not
We're
a-
in
it's
an
not a lie.
unprecedented time. It's obvious. You've never seen America shut down. You've never seen this many people die. You've never seen hospitals overrun. Not in my generation.
That's right.
Yeah.
So I keep telling them this is only, I agree, the beginning. And there's a lot of research on what the future would hold. I keep telling them we don't know that. We know who holds the future. We can get spiritual, and I'll go that. But what I can say is, God put us in this generation at this time, and where I agree 100% with you, Martha, is what will be said of you. And this is why I'm having the panel. This is why we will host the event. When everyone says, well, you're political. We had people in our church say, we're leaving. You're political. I promise you it's not political.
It's a health.
I'm
Yes,
telling you,
it's-
if you go in the
Yes.
hospital one time and go with me and visit, and this is what I tell I have some real close friends that disagree with everything. And I challenge them. I said, I know Dr. Keith Scott. I know Willis Knighton. I go up there. Come with me to tomorrow. Well, hold on now. I'm not saying it's not affecting some people. No, but that's the point. If it's affecting one person,
Right.
It should
we're
affect
talking
us
about,
all.
but it's
Right.
affecting the hall. It's affecting, they're full. Baton Rouge is overrun.
Right.
We should care.
And it's rotating people. It's not the same people for
Right.
the last year and a half. This is hundreds of thousands
Right.
of people who are rotating
Which
through these
the-
rooms.
And
Mutates.
talk to my mother, a palliative care nurse, who has held the hands of over 100 people dying of COVID and had to tell their family members.
Wow.
I mean, spend a day with her, your spirituality will change dramatically.
Yes.
And the other thing
And
is,
because
you know,
their
that-
loved ones couldn't
yeah.
hold their
That's
hands,
right.
which
Exactly.
is really
Yes.
sad.
and the people that are denying say, I have the right, and I have the right. Well, you know, from a patriotic point of view, I'm patriotic because I can
Right.
say I have the right not to do this. But I think that's the least patriotic thing that you could ever do is not get the
It's
vaccine.
confusing to me at the bare
Because you're
minimum.
not
I mean,
Because I'm
thinking
going,
about your
under.
country.
Because it's about others.
Right.
And
And this
We
is
have
where,
got-
Keith,
we-
it gets really complicated. And this is why Christian friends in the community, as you listen, because they're going to be coming at me, I can't find in the New Testament a significant, to be honest, any reference to where you don't care about others more than yourself.
right.
Right. Right.
That there is, so that any leader,
Right.
pastor, whatever, would come out and say, I just don't care. Or we would even have the appearance, and I know they wouldn't normally say it, but that we would have
Right.
the appearance of not caring.
Yeah. What you do for the least of my brothers,
You do it to
done
me.
I mean,
But
clear as day.
I mean,
So we could get. I'm not even. I'm not trying to get spiritual because I'm
Yeah.
gonna handle that on another issue.
But you know
But
what?
saving lives and saving souls go right like this.
Yeah.
Yes, and
But you
this
know
is
what?
why we love what you do, not just during the pandemic. Okay, listen, we try to encourage, we try to bring ice cream and feed staffs or whatever, prayer. All of those things matter because you chose with your lives to sacrifice for us. That's what the medical profession does every day. And for generations, we've respected that, we trusted that, we listened to that. And now at this time, when it needs to be more than ever, where I agree with you, I agree with is what happened. And I think as the Bible does clearly state, we have moved to, I don't care about anybody but me.
Right.
And that to me is why Christians, and why I'm having the forum, is like, we have to change that.
Yeah.
That cannot be our.
But if you had a heart attack right here, dropped right now,
Tell me you
would
take
you
care of
not
me.
want us to take care of you?
Yes.
You would turn to the doctors around you and say, help me.
Yes.
Because maybe the Lord put us there to help you.
Right.
You know, why does it have to be one way or the other? You know, I totally believe in rights. You have rights. We
Sure.
all have individual rights. But when you hurt me or you hurt others, your rights stop. We
Yeah.
stop it for everything else. I can put you in a sanitarium and force you to take medicine so you don't infect other people with TB if you refuse to do that, with tuberculosis. We still do that in this country. We put people away for years, the rest of their lives down in Carville for leprosy. Because we didn't, you know, we thought we were so afraid of how infectious it was. So historically, we have precedents
Sure.
for, you know, being able to force people to do things, but we shouldn't have to be able to force
No.
people to do
I
things.
agree with that.
This is taking care of the people around you. And you know how you said patriotic? When you take that vaccine, you're caring for your community.
Right. You're a patriot.
Caring for your state. You're caring for your country, because it could be one person in Louisiana that gets that virus changes in, that becomes something more dangerous, that now it puts the whole country at risk.
And it's obviously happening.
It's
We already see it
happening.
in the unvaccinated areas, how it's continued to do that. And we've gotten to Delta because of where we've been.
Right.
So let's go. You were going to say something. I have another couple of questions, and then we'll let you get out of here.
Go ahead.
All right. This is one of my favorites, and this is, I don't know where they get it from other than an obscure source, possibly. But the data that they are trying to equate, and Martha, you may be the best based on public health to be able to answer this. People say, well, more people are dying from the vaccine
No.
than they are from COVID.
So I know where they're getting that data
Okay,
from.
so let's talk about that.
So they're getting data from the vaccine adverse events system, where you have VAERS,
Okay.
your reporting system. So anytime anyone has anything happen right after they have a vaccine, it can be reported into this system. So if I get a shot, walk out and have a heart attack, someone can say, I'm going to report that into this system. CDC has people who all they do is review those reports. They have to do investigations into that case. Of all of so there are thousands of cases that have been reported into the system as possible adverse events. Of all of those, there have been 3 in the state of Louisiana that possibly could be connected as deaths to a vaccine, to this vaccine. 3. And they don't have any true data linking it for sure.
So they can't
But
say.
they can't necessarily completely rule it out. So they're counting those 3. All those other thousands of cases that have been reported have been ruled out. They've been investigated thoroughly by scientists who have said those don't count as, that's not connected.
Yeah.
Right.
And it's really hard to say whether something's connected.
Yep,
So
that's right.
more time than not, you're going to keep it in the system than not.
Right.
You know, if there's any possibility it could be connected,
'cause they wanna know.
They'll leave it in because they don't want to. If they can't completely rule it out, they're going to leave it in.
Right. So think of it this way. The other side of the coin is we never report the good things that happen, right?
Right.
In that system.
Millions.
It's a system, right? Nobody's going to write in and say, I won the lottery this week. It must be because I got my vaccine.
Right.
You know, nobody's going to, except in Louisiana, where we do have a lottery for the vaccine. But you know, that system only is able to look at what people report, and it is inherently biased toward negative associations. It cannot. The best it can say is we cannot rule out an association.
Okay.
Right.
Good.
And then some of that data also comes from there's a website called Open VAERS. That's where they're getting it from. And some of that data also comes from other countries that are using different vaccines that we have never approved in this country.
Right.
Too. So you also have to consider that source. But in this country, we are not seeing large numbers of adverse events, and definitely not serious adverse
Right.
events.
And the CDC has a separate system called Vaccination, which you can, once you've got your vaccine, you can sign up for, and it will query you on a daily basis.
Yeah.
If you've had fever or sore arm, those
How
kind of
did it
things.
do
How
for
did it
you?
do?
Yeah.
And one of the things it asks is if you're pregnant. And for those who are pregnant who've gotten the vaccine, CDC calls those folks, puts them in a separate registry to track anybody who's gotten the vaccines pregnant. Over 35,000 women have already enrolled in the pregnancy
Side of it.
vaccine database and registry. And again, not seeing anything that suggests that the vaccine is causing more different problems
Right.
or anything unusual that is not happening already. We know, for instance, about 10% of all pregnancies end early in spontaneous abortion. We're not seeing that number change at all in those women who've gotten the vaccine. Right?
That's good. That's
Yeah.
good data. The reason I want to try to address it. So on this is not your specialty, it's not why you're here, but Keith, you might be able to have a little bit of this. So when you talk about vermectin, you talk about all of the ways to why I don't need to get a vaccination is because I can go take these medicines
Right.
and it doesn't even affect me anyway, and I can buy that at Tractor Supply,
Right.
and
Right.
why would I go through it? So now, before I even, I know this is foolishness,
Nope.
but I have to bring it because
Nope.
these are the real
But
questions.
Please don't buy a cattle ivermectin.
Right,
Because
right.
we've had people put in the ICU
Right.
Yeah.
because
Toxic.
they're taking bovine dose ivermectin.
Right, for a 1,500-pound animal.
Right.
In
That medicine, first off, you want to talk about FDA approved, it's not approved for human consumption.
Yeah.
Right.
They're going into these feed shops
Yes.
and buying bovine cattle medicine, cattle and horse, and taking the dose on the bottle, which is meant for a 2,000-pound animal.
So now it is true though, or as it is being discovered. So let's say they don't go to cow dosage.
So
There is some data that's saying that these different ways to combat it. There are some new technologies or old medicines that might be effective.
So we look at the possibility of repurposing old medicines
All the
anytime.
time.
Sometimes we've done it with Ebola, we've done it with Zika, lots of things. And some of those medications show modest effects. Now, those are studies that are done in a test tube, in vitro we call it, studying the virus or germ in a test tube and asking, can we see a reduction in the amount of virus produced, for instance. Those are studies that are ongoing. There's been no home run there. These are not, things that in combination are showing us significant effects that would justify taking ivermectin or hydroxychloroquine and the like. On the converse side, that, all throughout this pandemic, physicians, especially in nursing homes, have been saying, we're not comfortable doing nothing, right?
Sure.
Right. And so we're going to try different strategies as we can in a logical way. They're off-label uses oftentimes, but there are physicians, in nursing homes and others, that have come up with sort of a cocktail strategy. They're using an anti-inflammatory drug, sometimes steroids. They may be using a blood thinner, sometimes prescription, sometimes not prescription. And some of those use agents like azithromycin, for instance, that help tweak our immune system just a little bit. But they're not proven strategies. There's no reason to rush out to ivermectin,
And they're under
hydroxychloroquine.
the care of
And
a physician.
That's right. And they're under the care of a doctor who is making a risk-benefit assessment about, is this a patient that's appropriate for this cocktail in this situation, right?
Yeah, and there's
that's
no
really
human
different.
trials at this
That's
point,
right.
and
And
it's not approved by the
How
FDA.
ironic that they're
I know.
willing to take things
No,
that
I-
are not
trust me,
approved for
Martha.
human consumption
Right.
or not approved for this
Well,
usage.
I
and
had
yet
a-
they want to take it, but they won't take a vaccine
Right,
that has
and-
been
and-
studied and proven.
And that's what a family member just texted me, I think yesterday. Same thing. And that was my response. So you go to Tractor Supply, but you won't go to Chevy Land and get a
Right.
vaccine.
Yeah.
Right.
That's studied, proven, and you're taking a drug that someone on
But
Facebook said
Yeah, and that's
it works
take,
with
yeah.
no absolute data. And the worst thing that has ever happened in our society with this pandemic is social media.
Yes.
Yeah, I get it.
The
trust me.
lies and the
Misinformation.
misinformation has so overcome science, and why people believe, you know, someone that works at Jiffy Lube over Dr. Vanchiere.
And that's why you're here.
Baffles me.
All right, look, I got to
Baffles
get to
me.
it. I got real
baffles,
quick.
so-
Yeah, it baffles us all. All right. When will a vaccine be available for 12 and under, do you think?
Yeah, probably not till the first of the year.
Yeah.
Those studies are ongoing. The 5 to 11-year-old cohort, we finished the first cohort about a month and a half ago. Another group will open up in a few weeks.
That's 9 months to.
And then the 6-month to 4-year-old age group is already enrolling also. So we're looking at first of the year.
So they expanded, right, how many they
that's right.
wanted in the trial so
Yep.
that they have even more safety
More
data
safety data.
because it's for young children.
Okay. So
And I suspect, by first of the year, we'll be looking at boosters.
that's what I was
Don't you
thinking.
think?
That's my next
Yeah.
question is
Don't
when
you
it comes
think?
to the-
Boosters are also under study
Right.
right now in each clinical trial, and there are questions about whether people who got J&J may need a booster sooner. We know that the high priority for those booster studies is people over age 65 and also people who have immune suppression
Right.
of some kind.
Well, because like with Brian, I mean, one of our guys, he's been vaccinated. He got COVID, and everybody's like, there you go. But it's still only 95% effective. So there's a 5% chance, or like in Baton Rouge, they said it was up to 10%. 10% of the people in ICU, they had been vaccinated.
Right.
So they were coming back and going, well, that's 10% of, it could be 100.
And
There's,
even so, they're not getting as sick,
right,
and they're far few people are dying.
Yep.
right.
So by far, if you look at the actual numbers overall of people vaccinated who have gotten sick and who have died, it's like 1%.
Yeah, well less than
For death?
0.02%.
Yeah.
I mean, it's a very, very low number. The number is less than 50 or 60 people who have died and having been vaccinated.
Well, I know in the Ochsner, LSU and Ochsner Monroe, 100% of the people in the ICU are unvaccinated.
Right.
100%.
It's pretty shocking.
And then the other
100%.
question you had there was, will we need a variant booster?
Yes.
Sort of, and that's also in development by each of the different
Right.
manufacturers of whether we need a cocktail of variants. The thing is, it's a moving target because it.
Just
Yes,
like
and
flu.
as long as
Just
we,
like flu.
and as
That's
long
Just
as
like
we
flu.
keep waiting,
That's
Right.
the more it
Yeah,
It
that's
can
right.
change.
So for right now, we don't need a variant. The vaccines a variant
Protect.
booster. The vaccine we have right now is
protect.
effective at protecting against the variants.
Two
we have.
questions, and we're out of here. How do you know if you had a variant? Is there a way, like,
Yeah.
does it matter?
It doesn't matter.
Doesn't
Medically, it makes no difference. And right now, what the state is seeing, more than 95% of all the cases in Louisiana are Delta variant, based on the
Yeah,
data from.
CDC just
Yep.
came out and said 93% in the country are
Yeah.
Delta.
Yep.
Holy cow. Okay, so that's good. Is there anything you can say to someone that says, I just don't trust any of y'all? Is there any way to gain that trust for someone who has lost it? In y'all's opinion, just
I'm trying to be, as one pastor told me, be found trustworthy. I'm a straight shooter. I'm going to be honest with you. I'm going to tell you what I do for my family, and I'm not going to mince words about it. And so I recognize that yes, trust takes time. I can't change the history, for instance, of the transgressions against African Americans in the Tuskegee experiments and other things. I can't change that history. I would if I could. All I can do is look people in the eye and be honest, and hopefully be found trustworthy to them and to God, and serve a higher calling every day.
You have to meet people where they are, and you keep going back to where they are. And the more you talk with them and the more they grow to trust you, the more you're likely to affect change. But what I do say to people who are digging in their heels and saying, I'm not going to do it, then the least you can do is always wear your mask. And you're not the ones that just wear your mask when you're indoor with a large group of people. You wear your mask all the time when you're outside your home, unless you're by yourself or widely spaced, because it's not only to protect you, but it's to protect the people that you're around.
Right.
You owe that to people. If you're going to say, okay, I'm not going to trust this vaccine that has been studied and put in your hands to make you safe, if you can't do that, then the least you owe your community is to wear your mask.
Right.
And if you're sick, to stay home.
And I say that of the vaccine, it's not about protecting you.
Right.
I mean, the godly thing is you're doing it to protect so you don't spread it. You don't give it to your neighbor or someone in the grocery store or someone else. You wear a mask, not to protect you, because, you know, that's you. But do you want to give it to someone else? Because if you give me the virus, how do you know you're not killing me?
And
And how do you know that you're not putting a gun to my head? And if you say, well, if I get it, I get it. Okay, well, let's play Russian roulette. If it's your time, it's your time. That's not what God did, because God gave us tools. Why do people think that God only inspires pastors and not scientists?
right.
So
Right.
They hit their head on something. I can
and
promise you.
So, I mean,
And
God
see-
inspired the people that have done this and the people that are doing this to help society. And you know what? We've learned so many lessons about each other, good or bad. And maybe this is the downstream effect is we are going to grow as a people, either because we get together and conquer it, or we split apart and we die with it.
Right.
And it's
And
going to be
I've
that much
had-
of a character issue.
I've had those people. I've had the 35-year-old girl who refused to get vaccinated, who got sick and brought it home to her unvaccinated husband, who then died. How overwhelming is that to her?
Right.
I've had those people call me crying, and how
Yeah.
do you address that with them? I can't say
Yeah.
that she's wrong. She did bring that home
Right.
to
Yeah,
him. And that's something she's forever going to have to
Right.
live with. And I have a nurse whose brother brought it to her family, and of the 20 people at lunch after church, family lunch, 7 people in the hospital, 3 in the ICU, and 1 died. And he brought that into his home.
It's tough.
He would have never meant to harm those people, but that's what we have to understand. We are harming people.
Right.
Yeah, it's not a joke. It's happening.
It's
And for your
it's-
children who can't get vaccine now, do it for them.
For them.
Do it for those who are with you, who are immune compromised.
Especially, yeah, like if you're in the school system too, that's what I hope and pray that people understand, that that's another side of it too, is like if the children can't, we can to
Right.
protect
Right.
them or whatever.
Right.
Last thing, and we're out of here, is who do you go to trust for your information? If someone's trying, because in the social media world where it is chaotic and they don't know, and this is why I am eternally, genuinely grateful for you taking time to do this. Y'all are busy. You could be a lot of different places, but I do trust you. I do thank you for what you're doing. And I'm trying to help people develop that trust because I trust you. I know you. I want them to have the same thing. But if someone's still trying to figure that out, where do you go? What do you look at, or where do they gather that information from?
Yeah. So I think one of the best sources is the CDC's website, because the CDC has sort of 2 different tracks, one for healthcare professionals, providers, and one for common folks. Anybody can look at that information in simple terms and boil down.
Right.
They have lots of the frequently asked questions. They track the Delta variant. You can see graphics like this. You can really see a broad section of information about just pregnancy or children or how the vaccines are made. All of that stuff is there, and the CDC folks are experts at what they do and helping communicate that out for us. So I think that's the top website I would put out there for people.
And John Hopkins' COVID website is another one that's very user-friendly.
Yeah.
You can track
Really cool
country,
graphic.
state. You can do parish, county in any state, and it will give you that data. It's CDC is easier to navigate than the John Hopkins, but they're both, they have no, horse in this race.
Yeah.
This is just straight data.
Yeah,
they're
trying to figure
not
it
they're
out.
not massaging anything. This is straight data.
And
So
one
it's
thing
very
people
good.
ask me about all the time is, why is the World Health Organization different than CDC's recommendations? And they're dealing on a different scale.
Right.
CDC is taking in what we're learning from other countries, but they're looking at what's going on in our
America,
country and making recommendations. That's why the state of Louisiana will always follow CDC. So something may change on the World Health Organization level, but that may not be something that needs to change here. So
Right. They're looking at Sri Lanka,
right.
Ireland, England, and trying to
Right.
compose. We're looking at the U.S. Yeah.
Yeah.
Louisiana Department of Health has excellent information.
They do.
Again, more Louisiana specific. easier, a little easier to navigate among the CDC.
It's just ldh.la.gov.
Yeah.
Okay.
Yeah. Very good. And then the last thing I wanted to bring up was, a lot of people are unhappy with the governor putting in a mask mandate, and none of us wanted that to happen, especially the governor. Mm-hmm. But we're in a situation now with this surge, like no part of this pandemic before, that really it's the right thing to do. It was the right thing for him to do, and we all support that vigorously. We want to make sure that parents don't politicize this with their kids. Really, it's not fair to the kids to put them in the middle of this, and it's for their best safety to wear a mask.
And can I tell you that, unlike most states, Louisiana went back to school last year, right? Yep. So we had options, but some hybrid and some, but they were back in school. As public health, who monitors all of those children in school, and teachers and housekeeping and everything, janitors, bus drivers, we saw almost no in-school infection outbreaks. We had people who were sent home. A child may have come to school and possibly exposed other people. Not many, because they were very good at masking and social distancing. Most of the children that were exposed to each other were outside of school at some activity, either a birthday party,
church activity,
a birthday party, or a sleepover, or a bunch of teenagers got together and went to dinner. Whatever reason, they exposed each other outside of school. Very little transmission within school. We know how to keep our children safe, but it involves masking. And if you're not going to mask, this is what I always say. I had a superintendent before the mask mandate called and said, well, Dr. Whyte, we're not going to require masks. We're not going to do that this year. And I said, oh, you will. And he's like, what? And I said, well, in a few weeks, you're going to have outbreaks, and then you're going to have school closures, and then guess what? You're going to require masking. Because there's just not a choice. It's so contagious. It's going to spread like wildfire if you don't wear a mask.
Children are much more vulnerable than they were in the first round.
That's right.
A year ago.
Well, we see that on the numbers.
That's right. Exactly.
And the other thing,
I mean, put that back up there, Kath, that graph, if you don't mind.
My daughter's school district, where her children go to school, they sent out a petition that they will not wear masks and they'll take responsibility. And she had the best response. And she said, okay, so you take responsibility if your child gets COVID. So you're going to pay my child's medical bill?
Yeah, that's the
Right.
part that's not even
Are you
really
going to take
considered.
my child's responsibility?
Or mine?
Or mine? And if you're not going to do that, then what is the best lesson for our kids? Take care of your brethren. Take care of your fellow student. Take care of each other, and wear a mask.
Those parents who don't want to send their kids to school with a mask, they can homeschool.
Sure.
There are other options for them.
Right.
They can use virtual technologies. There are ways that they can do that. But
K
to
through 12.
politicize it
Yeah.
for our kids is just not
Right.
a good way to
It's
do it.
not
I'm
acceptable.
only bringing it up because you brought it.
Yeah.
The younger people are affected now. They weren't before.
That's
And you can't see the less than 18, but they're that little orange dot, see,
right.
Keith, right at
Right
the top?
there.
That it's
Look at that.
underneath the
Look-
yellow.
Look at there. Here.
And it's
All
higher
the way
than it
to
was
there.
at the peak.
Yeah.
So this is
Right.
why, when it comes to data, this is why, please, if you're watching, listen to what I'm telling you. They're just trying to help you.
Right.
This is what's so frustrating. What do you get a pay increase, by the way? Are y'all getting extra bonuses for this?
Are you kidding me?
No.
Oh, you mean
We
you're
work
not
for the
getting-
state.
You mean the CDC?
We all work. We all work for the state.
The
We all work for
CDC
the
is
state.
not sending y'all money extra to do that.
No, and neither are pharmaceutical
let me
companies.
tell
Yeah, are you sure, Dr. V? This is what's so
In
crazy.
the
I'm
height
like,
of this, how many extra hundreds of hours
that you didn't get paid. Oh, that's what's so
in a
ridiculous.
week, in a pay period, you know?
Yeah.
I
This
mean,
is why I'm just telling you,
Crazy.
thank you. Thank you for taking your time. Thank you for answering the questions. Cannot
Wish
thank
we
you
got
enough.
paid.
Thank you
Can
for having
arrange
us.
it
And
for us to
Yeah,
get paid?
hourly rate would be great.
I'm calling whoever. I'm trying to get you
Call
more
the
money.
governor.
All right, look, let me pray for you because
Yes.
the Lord knows I need to. Man, I just cannot thank you, Lord, enough for these men and women at this table and their friends, their co-workers that have dedicated their lives to protecting and serving this community. And I pray, God, that they would know what they mean to many of us. Although the media may skew things or social media may skew things, let them know there is a group of people that believe in them, that trust them, that support them, and will do anything and everything we can to try to help them. And they have done that for us. It's the least we can do for them. And that they would give us their time today means the world to me. Thank you for the people that ask questions. I know there are genuine concerns and people trying to figure that out. I pray that today will help them get some clarity and that they'll be able to make the decision that is best, not just for them and their family, but for those that surround them in this community. I love you. I ask you to give them strength, give them wisdom, God. Continue to help them as they help us. In Jesus' name, amen.
Amen.
Man, what an amazing time, and I can't thank you enough for watching. And if you're the kind of person that wants more information or you still have some questions, I'm reminding you once again, email me, justin@thesimplerchurch.tv, and I will do my best to try to answer your questions specifically. Not me, but get it to the experts so that we can make sure we're doing everything we can to be a part of solving problems. Also, just so you know, we're going to break this whole hour-long talk into some sections so that you can share it with your friends, maybe someone who's on the fence trying to figure some things out. Maybe it would help them as they're trying to navigate what to do in this very difficult, challenging times. I want to remind all of you, if you think I'm political, I promise you I'm not. What I am concerned about is your health and the health of this community. It really doesn't have anything to do with politics for me. It has to do with the fact that we are in an unprecedented time where people are losing their lives. So whatever we can do as a church, what I can do as an individual, what we can do as a family to help solve that problem, I want to be a part of that. So hear my heart. I hope you know exactly what we're talking about and why I'm sharing this with you, because to me, there's never been a time that we should be standing up, not for the wrong reason, but standing up for the right reason, and that is for the love of your neighbor. So thank you for watching. I can't wait to hear from you. Thanks again to the doctors for being a part of it. Got more questions? Make sure you send them to me. Thank you again for being here. Till next time, peace.